him falling. He fell all the way down there. All the way. All the way down there. All the way down there. All the way down. So all the way down. Wait, all the way down to this. Oh, he almost hit me. He almost hit me. Okay, I'm not gonna do that again. Never. Wait, is he hiding? Is he hiding? Is that we haven't killed him yet. We haven't killed him yet. Is he hiding? I hit him.
Hey y'all. So if you hear anything in the background, can you hear me? Can you type yes in the comments if you can hear me? If you hear randomness in the background, it's my son playing his video games. So sorry for that in advance. Hey guys, come on. I'm waiting for everyone to come on and join before I start with the tips and the tricks. If you don't know me, I am Renee, expert nursing coach from New Nurse University. This is the group that you're in. I want to say welcome to everyone. Thank you for tuning in. You guys are awesome, by the way. I know we have a lot of NCLEX and nursing students and new nurses in the group, which is great. The content is the same for all of us. There is no different, even though we may have different titles. Okay. The concepts are still the same. I don't know why they make us go through these different tests to prove ourselves over and over and over again. But I guess the repetition and experience is needed. Okay, so if you're stuck on your HESI and you can't pass, or your ATI, alright, you just have to learn the concepts. And this is the purpose for this video today. Getting to learn the concepts and how these tests work internally, okay? Alright, so let's get started. So, HESI, how do we approach this darn test, okay? I had to personally take HESI myself, along with several other classmates. And it was a challenging test, I must say. But, I want to say the way I prepared myself was a little different from the way everybody else prepared themselves. I was really in tune with my study habits, like I preach all the time. I was really in tune with Testtaking Strategies, all right? And I learned the components of the HESI test, and I studied the categories that were on there. So I've narrowed it down to a couple of things, a couple of ways you can approach the HESI exit exam, okay? The first thing I want to say is you can absolutely use the Saunders book. I use the Saunders book. I use the HERS review to go over the med-surg systems. I absolutely used NCLEX Mastery, and I used some of UWorld as well, okay? Just because they have the name NCLEX attached to them, all of our nursing, core nursing interventions and concepts are the same, all right? If we have a respiratory patient that's short of breath, we still need to set them up, period. No matter if you are a advanced practice nurse or no matter if you're the student nurse that just entered the room, all right? The concept is the same. So, HESI is heavily weighted. It's a heavily weighted test, all right? They base their scoring on medical dosage calculations, hotspots, all right? the picture that shows up, and you have to put the little X, you know, where the rib cage is, or yes, the hot spots. The audio, where you have to, you know, have your earbuds in and listen to see if it's lungs, crackles, or if it's rails, which who can tell the difference? Or rhonchi, yeah. It's also heavily weighted on drag and drop, okay? The ones where they list them in out of order, and then you gotta put them in order, the steps. So those are a few things that you need to pay attention to. You need to learn how to approach those categories, okay? Those questions, those different types of questions. And who can forget select all to apply? It's heavily weighted also on how many select all to apply that you can get correct, okay? So let's go over that one more time for the people that are just joining us. HESI Exit, we're going over how to approach the different types of questions that they have. So they're heavily weighted on the dosage and calculations, all right? They're heavily weighted on hotspots, select all that apply, drag and drop, and the audio. So let's talk about dosage calculations. Keep it simple. Keep it simple. Learn your conversions. All right? Grab a friend and have them quiz you on the conversions. We know kilograms to pounds. We should know, milligrams to, milligrams to grams. All right? Milliliters to liters. Absolutely, you have to practice that. Okay? So in the group, we absolutely do have a conversion sheet somewhere in the files tab. If it's not there, I'll go through the files tab. If it's not there, I will post a conversion sheet for you just to sit. You know, my thing is 15 minutes a day, every day, you'll get it down pat. If you do that for 2 weeks, you'll know your conversions, okay? So that's the first things first. You absolutely have to know your conversions, and you absolutely have to know when to use them, all right? If your question, you have a medical dosage calculation question, and they are asking you to do milligrams per kilogram per minute, guess what? You have to convert, especially if they give you a person's weight in pounds, right? All right? If you like this review so far, can I have some hearts, please? I know people are not used to this Facebook Live stuff, but I feel like y'all kind of dry. But no, seriously though. So you absolutely have to know your conversions, and you have to know when to use them. That is an absolute most important. And that's going to keep you from getting stuck on these medical dosage type questions for HESI, okay? And for NCLEX as well. But this is more so less about HESI. So the next thing you need to do is you need to learn your formulas. Guys, they set it up for you. The formulas tell you what to do. If you have a drop factor, everybody hates drop factors. Okay, fine. Learn the formula, learn the rules to drop factors. One of the rules to drop factor is that if you have a drip set of, I think it's 10, 15, and 20. That is your, I want to say that's your macro drip. And then if you have 60, that is your micro drip. Okay? You absolutely have to go write that down somewhere on the conversion sheet. Write it on your, flip your conversion sheet over. Make yourself a conversion sheet of all the conversions that you need to know. Flip it over on the back. Write down all the formulas that you need to know. All right? And that is something that you absolutely want to write down, so that when you get a medical dosage question that says you have a drip set of, or if it says a macro drip set, then you know, okay, it's 60. Got it, and then you can move on. You don't have to sit there being stuck like, what's macro? What's the macro drip set? We ain't never learned that at school. Lies. Yes, you did. You just, like skipped over it, okay? You absolutely have to hone in on that stuff. So if you have something that says that for the drop factor, you also have a formula that goes with it. Volume times the drop factor over time. Period. Do what your formula says. Don't add nothing. Don't get confused about what you should be putting, in the formula place. Listen, if you have a volume, you know it's going to be milliliters. Whatever's attached to those milliliters, you absolutely have to put it in that space. So 100 milliliters times your macro drop factor, which is, what did I say? 60, divided by time. They may give you 8 hours. They may give you 2 hours. They may give you 4 hours. And then you just calculate it, all right? So those are the two main things to approaching dosage calculations for HESI, all right? Knowing your conversions and knowing your formulas. You have to practice. Go on YouTube. That's what it's there for, all right? Somebody else willing to break it down for you, go on YouTube and find a video that you can understand. If you don't understand, like me, I always do my conversions separately away from my formula problem. Meaning I convert first and then I do my formula, plugging in my conversion. A lot of people can do their conversion within the formula process. That's not how my brain works. So find you a video that you can understand, okay? So next things next is hotspots. Your hotspot is your fundamental skills. Fundamental skills. Your clinical skills, along with the audio and the drag and drop. Those three things. Fundamental skills is the biggest category on HESI, along with the med-surg. Fundamental skills is the biggest category on HESI, along with med-surg. So if you're a nursing student and you have a clinical skills book, I advise you some of the most important things that you keep hearing over and over and over again. You need to start writing those down on note cards, okay? Steps to putting in a Foley catheter, glucose steps, not the PTINR, what is it? The insulin, how to do the insulin steps. Cloudy versus clear. You guys need to start writing that down. Get a ring, get a stack of note cards, punch a hole in them. That way you'll have them with you all the time, okay? What else? Clinical skills like, there's so many of them. The IV insertion. This stuff comes up on NCLEX too, guys. And I think I use UWorld to write down those steps. Any drag and drop I got on UWorld, guess what I did? I put on a note card and I studied it, okay? Race. They always have race and pass for some reason as a question on HESI for the fire extinguisher and how to rescue and all of that. For the audio, they always have, like I mentioned before, the rib cage where you got to put an X on the aortic or pulmonic valve or, mitral, mid-clavicular line, all of that stuff. So those are things that you have to actually go into your clinical skills book, or you could use UWorld, because I know UWorld has some drag and drops, or any question bank that you have that they have drag and drop. Write those steps down so you can continuously go over them. So we went over medical dosage calculations, how to approach those. We went over hotspots, that is your fundamental clinical skills, along with your audio, that is also fundamental skills, and your drag and drop. The information is coming from fundamental skills. And you can absolutely use your Saunders book. Go into the one where they're talking about which size needle is this, or how to hang IV TPN. You need to know those steps, okay? Those steps are in your books for a reason. Or if you have your regular clinical skills book, you need to learn those steps and write them down and go over them, okay? Please put your comments down, and please put your questions down in the comments if you have any. All right, for the people that are watching. So let's get to the drastic select all that apply. Okay. Select all that apply. You just absolutely have to use test-taking strategies for. Period. And there is not one test-taking strategy you use for select all apply. Everybody says true, false, true, false. Well, true, false didn't work for me. I hated using true, false. I didn't understand it, okay? And that, I guess it came from Kaplan, which is fine. If it works for you, absolutely use it. Just didn't work for me. So what worked for me was expected versus unexpected. I would literally go down the list of answer choices. Okay, is this expected? Would I, as a nurse, do this? I would ask myself those things. Eliminate your answer choices first. Just don't dive in trying to pick the correct answer. You may miss something. Go over your keywords. Test-taking strategies is important, very important, and a lot of teachers, I'm going to say teachers, do not implement test-taking strategies, or if they do, they spend 20 minutes on it and then it's forgotten. Test-taking strategies, I feel like, should be implemented as early as possible in the nursing, in the nursing journey. I absolutely feel that way. And the earlier you start implementing them, the more you get more comfortable. You don't have to be guessing, oh my God, which strategy should I use for this question? No. If you practice them and get good at them, okay, then you will absolutely be able to use test-taking strategies on the things that you get stuck on. Strategies only work when you practice them. You cannot be guessing about strategies and guessing on your questions. That is a no-no. If you have to guess on a question, you need to go back and review content, okay? What else? Any questions? Pharmacology. You absolutely need to approach your pharmacology questions. So you need to do pharmacology questions for HESI, because I want to say it's a big chunk as well. Learning those classifications and knowing what is inside the classifications. They'll give you a lot of drug questions, unlike maybe NCLEX, they may give you one or two, pharmacology questions. But we do pharmacology, like strict pharmacologist pharm questions, in order to be able to question the doctor about the drug, about the dosage, about the time frame, about, if they are on heparin and they're going to surgery, do we stop this heparin? Things like that. If it's a wrong order, can you recognize it, or you just gonna give it because it's the doctor and he said give it? That's why we do pharmacology questions. The more you do pharmacology questions, the more you can put a related disease to what you are doing as a nurse in your interventions. Let me give you an example, because I'm all about examples. I don't just spew information and just leave you hanging, okay? So if you have a patient and they are in renal failure, okay, but the doctor orders, let's say he orders potassium sparing diuretic. What are you going to do? You going to give that diuretic? And they're already retaining everything. The kidneys are not working, so everything is building. All right, the potassium is building, sodium is building, everything is getting retained. So you're just going to give them that diuretic, that's potassium sparing diuretic? No. You're going to question them. Did you mean to? That's the same thing you need to do in your questions. Okay? Absolutely. Even with the labetalol, you going to give a beta blocker to an asthma patient if it's prescribed? No. All right? We do pharm questions in order to question the doctor. All right? In order to be able to teach our patients what this drug is. You need to teach them, you need to teach the asthma patient, okay, your rescue inhaler is going to be your bronchodilator. You use that first. Then you use your steroid, okay? They have questions like that on HESI. You need to be able to identify the information. That is why we do strict pharm questions. I swear to you, that is going to help you tremendously across the board. It's like you're learning different med-surg diseases, at once because of the pharm that is incorporating. Okay? Any questions? Does anybody have any questions? I know some people had exams coming up. Maybe tomorrow or this weekend, or not this weekend, next week or later on in the year. You absolutely want to approach HESI by categories, all right, and the types of questions that they are going to ask. And you do have to add test-taking strategies. Now, a lot of people, they use the green HESI book, which is fine if you are learning from it, if you are applying the information. If you can apply the information to the questions that you answer, by all means, use the green HESI book. Did it work for me? No. I had my Saunders book in nursing school. From day one, I used my Saunders book, okay? I highlighted, I wrote things in margins so I could, whenever I flip back to it, I can remember, okay? You can use the Saunders book, absolutely. What else? NCLEX Mastery. I passed every single, except for geriatrics, because that was boring and I didn't like it. But I passed every single specialty HESI, like fundamentals HESI, pharm HESIs, by using NCLEX Mastery. Yes, it's for NCLEX, but guess what? The content is the same, even for LPNs, all right? They slap these different titles on it. They repackage it with the same branding. It's the same information. All right? So, listen. Approach your categories to your HESI. All right? If you are borderline and you need a 900 and you're just like 850 or 899, test-taking strategies. They only work if you practice them, all right? You need to know how to use test-taking strategies on different types of questions that they ask. And we just went down them. I'll give them to you again. You have medical dosage calculations. There's a strategy to use to answering medical dosage calculations, and the strategy is know your conversions and know your formulas. And then you have to practice. Period. Those are the study habits you should be using to conquer and master dosage calculations. The next question type is I said was the hot spots, the audio, and the drag and drop. Those are your clinical skills. All right. Those are going to have to be memorization. Get some index cards. Write those things down as you come across them. If you're preparing for your HESI, you write stuff down as you come across it, and then you'll build up a stack like that, and then you just continuously go through them. 15 minutes a day. If you're sitting at a red light or you're sitting at a train, you better have those cards in your bag. Whip them out and just look at something. Color code them. The brain remembers colors, guys. Color code your notes, okay? And then the select out and apply. You have to use strategies when applying, when you're tackling select out and apply. Again, HESI is heavily weighted on dosage calculation, hot spots, select out and apply, audio, drag and drop, and the biggest categories is fundamental skills and med-surg. All right, those are the two that you have to get under your belt. You have to get those down packed. You have to absolutely know what is in each system overall, okay? We know that the respiratory system, how do we approach med-surg? Okay, fine. We know that in the respiratory system, our number one prevention is respiratory distress. You need to learn nursing interventions that are going to absolutely prevent respiratory distress, respiratory failure. That means dieting, preventing aspiration, positioning, sitting your patient up if they're short of breath. We want to promote lung expansion, cardiac. You absolutely want to know the blood flow of the heart. All right, if you don't know which way the blood is flowing, how are you going to know your cardiac output? Cardiac output, you need to know what cardiac output is doing at all times. All right, so if it's up or if it stays down, what are you going to do? You have to ask yourself that. Put yourself as the nurse. What else? Gastrointestinal. You need to know about your acid-base imbalances. All right. What else? Kidneys. You need to know the renin system, the renin-angiotensin system. You need to know about that. Go to YouTube, find a nice video, and watch it. YouTube, by the way, has very, very nice animated video about patho. They'll give it to you in 2 minutes or less. You can watch the video over and over again, and you'll have patho in 2 minutes or less on a disease process that you could have been reading about over and over in Saunders, you know, and not grasping it. Go to YouTube, watch an animated video first. Go to Saunders. I bet you it will come to life then, all right? Did anybody see that video of the pulmonary embolism that was like this long on YouTube? I bet you to change your mindset about pulmonary embolisms. The way they pulled it out. If you didn't see it, go watch it. It's amazing. What else? Musculoskeletal. You need to know about traction. You need to know about the amputee. Which leg needs to be elevated, what time. You need to know about osteoporosis and rheumatoid arthritis. Okay, those are some of the things that are inside of your med-surg topics. You absolutely need to know about those things. Neuro, you need to know about the stroke patient. You need to know about brain changes, ICP, all right? Pick up on the patterns during your questions. I absolutely encourage you to study by systems. Stop doing your questions by selecting all categories if you do not know your content. It's very time consuming to remediate all that stuff, and it goes in one ear and out the other because after 20 minutes, your brain is distracted. Okay? Get organized. I preach to you guys all the time. You need to get organized, and this is how you do it. All right? What else? PEDS. It's like a mini med surge. Okay? You have to go at it one system at a time. And know that the PEDS patient is very different from the adult patient, along with the maternity, along with the elderly. Okay, so you need to know the different nursing core content and your interventions in those categories as well. I know I'm rambling. Does anybody have any questions about how to approach HESI? Any questions? Put them in the comments below if you have any questions about HESI. I'm not answering questions about NCLEX. I'm here to teach you how to approach HESI and pass. Okay? This is how you pass. Repetition, repetition, repetition. And I'm going to tell you the same thing for NCLEX too. It doesn't change because the nursing core content is not going to change. From LPN to RN, like I said before. Whoever walks in the room, if your patient is throwing up and laying flat, guess what you got to do? Sit them up. That is, you know, that it doesn't matter if you're the LPN or the nursing student or the janitor. I mean, come on, man, sit them up. We absolutely want to prevent our respiratory failure. Okay. Yes, please study by systems because that is the way you master core nursing content and your interventions, one subject at a time. You're able to pick up on patterns that are throughout that system or subject, no matter the disease. You have to think bigger, all right? Don't just think, oh my God, I gotta learn all these signs and symptoms to pneumonia. No. Overall, we want to push fluids. We want to sit our patients up, and you know, want to monitor airway, breathing, circulation. You got a respiratory patient, their O2 status is 80. Guess what? That's a medical emergency. You have to be able to identify respiratory distress or respiratory failure. That is the overall big picture of respiratory. Okay? No, I am not talking about HESI entrance. That is very different. That's a very different test. HESI entrance has to do with the basic math. So multiplication, subtraction, addition, fractions, all that stuff. Basic science and biology, A&P. Reading and language arts. That is like prerequisite. HESI entrance tests you on prerequisite knowledge, not nursing knowledge. Okay, so it's a very big difference, and this is for the HESI exit exam for nursing, for the nursing career. Thanks, Barbara. Very, very great question. Very, very good question. Nucleus Medical. Nucleus Medical. I like them on YouTube. They have a lot of interesting, short, animated videos that take care of the patho. All right. I learned about pyloric stenosis just by watching a YouTube video from a question that I had got wrong on pyloric. I'm like, pyloric stenosis? We never did this in nursing school. I don't know about that. Went to YouTube, watched the animated video, and I'm like, oh, okay. So on the next time I got a question about pyloric stenosis, I knew what it was. I knew how to eliminate my answer choices, and I got the question right. So that needs to be a growing trend when you are answering questions, okay? What else? I'm looking for questions, guys, okay? Can I get some hearts, please? If you know how to do the hearts on Facebook. I shouldn't be asking for hearts. Let's see. Which subject weighs the most on HESI? So one more time. HESI is heavily weighted on medical dosage calculations, okay? Hot spots, audios, drag and drops, and select all that apply. All right. We normally get the multiple choice, but they like to see how many of those specialty type questions you're going to get right. So that is what you want to focus on. Those are the question types that you want to master. And then too, the HESI has nothing to do with the NCLEX. Don't believe the hype of, okay, if you pass your HESI, you're going to pass NCLEX first try. No, because I passed my HESI first try and I failed my NCLEX first try. So it absolutely depends on your nursing foundation that you have, the type of core nursing content that you have in your own brain, okay? Not your neighbor's brain, not your classmate, all right? Because guess what? NCLEX and HESI is all about strategy. All right? Some of the most unintelligent people in the room can pass a test just because they know how to pass tests and don't have anxiety. But you could be the smartest person in the room and fail all your tests just because you have that anxiety. So different factors come into when you have to take a test. So I just feel like all these exit exams, they don't really have anything to do with it. I just feel like that's their way of giving you a comprehensive review, maybe, before you actually go take your NCLEX. But HESI, ATI, all that, it doesn't have anything to do with NCLEX. Because NCLEX is its own beast, and it's scored way differently. So, all right. Yes, so Lakeisha, it was NCLEX Mastery app. Yes, it was. For the RN, they have it also for the PN. I suggest, guys, yes, absolutely, absolutely. Buy it because it does not expire. Use those questions first before you go spend money on UWorld, because UWorld expires. Even though UWorld is better, only because of the pictures. All right, I feel like some of the rationales are the same, but UWorld enhances it a little bit more because I'm a visual learner and they have pictures and boxes and all that stuff, and it's bright and white and blue, and you know, they play off the color. Remember, the brain remembers colors, so they're going to throw some color in at you versus, you know, NCLEX Mastery is trying to come around. If you do it on a computer, it's white and bright, and I think on the app it's white too now, but before it's that dreadful green. But you can pay attention to your streaks on NCLEX Mastery too. That's something I like. And you can study by systems. So get your practice in with NCLEX Mastery. It's not just for NCLEX. You can use it for HESI too. A lot of people like to use yourbestgrade.com. I used it briefly. I didn't really like the rationale. I stuck with NCLEX Mastery. But you can absolutely use it if it's working for you. You just have to know if your question banks are working for you, okay? You have to evaluate that. And the way you evaluate if your question banks are working for you, because, you know, everybody says, just do questions. Okay, well, no. If the way you evaluate if it's working for you is you have to say to you have to ask yourself, is my critical thinking matching up to the question rationales before I even, you know, read the rationale? Or am I close? Or did I just totally miss the question? I didn't know what the hell was going on in the question. I don't know what, you know, this test even is. I've never seen it before. Okay, so then you got some work to do. Any more questions?
Somebody could check me and then switch my weapon.
If there are no more questions,
I'll be switching my weapon.
I will definitely, I am definitely going to do more of these. I might do content ones. I don't know if they're going to be free though, but it's time that we, you know, get to the next level on our nursing journey. Okay? So, without further ado, you guys are so awesome for tuning in, and thank you for being in the group. Add as many people as you can. Make sure you tell them to fill out those questions, all of the questions, or they won't get in. And we'll be having some more interaction later on in the week. Okay? So you guys have a great Friday night. Thank you for tuning in, and I will see you guys later.
Alright, it's done.